Hi, I wanted to make a video because it's been a while since I made a video and I'm having a particularly hard day today. I didn't sleep last night. I kept having those strange sleep paralysis episodes, and the back of my brain has been vibrating. It's hard to describe, but for those of you who don't know me, I had a really botched decompression surgery in 2015, and we went a couple of years. I was just recently told by Stanford that my brain is slumping. I went in to get to find out what had happened with the vertebrae issues with the post-surgical problems of not checking for for the cervical cranial instability before doing the decompression surgery. And what I actually ended up discussing was that my brain is slumping because too much skull was removed from my brain. Or from my head, I'm sorry. Anyways, it's been a really, really rough night. I took medication this morning and I was able to get about 3 hours of sleep. And then I woke up with projectile vomiting. I'm making this video because I am one of the fortunate people out there, or unfortunate people, whose condition is so extreme that the doctors are still willing to provide medication for me. There was a period of time that I had taken myself off pain medication because I didn't want to be a part of the barbaric, abusive pain management system that we have in our country, where we have to count pills and take urine tests and basically be treated like criminals due to the behavior of other people diverting their medication or abusing it. So I went back to my doctor one day and I was suicidal, and he decided it would be best for me to go back on at least something. And then his clinic closed about 2 months later. We were told he went out on medical retirement, when in fact I had just found out from a social worker last week that he was ousted out of his practice in our community that he had had for decades, and it was because the DOJ thought that he was overprescribing. He was giving me Tylenol 3, so he definitely wasn't overprescribing in my case. And I don't think I was overprescribing in any case. I think there's a awful witch hunt out there on doctors who are compassionate. I'm making this video mostly to show that even when we do get pain medication, it doesn't make us high. It doesn't take our pain away. If I took enough pain medication to make this stop, I would be dead. And I don't want to be dead. I want the pain to stop. I know I'm going to have some pain all the time, but in a situation like this, where it's excruciating, I should be allowed to go to the emergency room and be treated with compassion and taken care of. And obviously there's something, the brain slumping, among other things. There's something very seriously wrong with me if I'm experiencing this much pain. And what would happen if I went there would be I would be treated like a drug seeker, or dismissed or blamed, or told to lose weight, or they're just insane. They don't have the ability to help the situation that I am in. So rather than admitting and administering pain control and until the surgeon can get in there and figure out how he's going to fix this, their answer is always to call it a migraine and send me home, which is just extremely traumatizing. So I am making this video to show that when we take our pain medication, it does not take away all of the pain, and it does not make us high. We are still articulate. We are still able to formulate thoughts. I'm not nodding off. I'm I don't even know why we have to sit here and defend ourselves to this. This is barbaric and inhumane. So rather than go to the ER and try to get a little bit more relief safely with doctors and nurses around me, I will take the prescribed dose and I will suffer through this. And I hope that I get my surgery soon. And I hope that that one doesn't end up botched too. And that, I feel like I'm in good hands. I'm at Stanford now, but I thought I was in good hands when I was in Sacramento for my surgery. So, part of the pain management problem is you go in there and they either don't understand the extent of your pain, or they tell you that you're not doing enough to correct your pain. And so that's what happened in my case. Is I did research my doctor, and there was no major red flags for him, and I chose him, and I still ended up really hurt. And I feel like if I would have had more time to not felt so much pressure to fix myself, then maybe things would have turned out differently for me. So I'm really sorry for all of you out there who are suffering like I am right now, who don't have any pain medication or support. I've been through that, and it's awful, and we shouldn't be treated this way. Something has to stop. We have to stand up. We have to fight. All the groups need to unite. They need to stop squabbling within themselves and come together, because people are dying and suicides are happening. Even the doctors are killing themselves now because they can't prescribe. And it's got to be hard on them when they see their patients, who are suffering and they can't do anything to help, let alone the fear of having their licenses stripped or being jailed. So, you know what, America, wake up. Pain patients are not drug addicts. I mean, it's like, I've heard everything from less than 1% to 1 to 3% of people are become addicted to pain medication. My theory is they didn't really have that much pain in the first place, because if they did, they wouldn't be getting high off of it unless they were taking a ton, which is stupid and doesn't help anybody. Either that, or they were genetically predisposed to having an addiction to certain substances. We have to stop this draconian crap of blaming substances. Aberrant behavior is different from dependence. Aberrant behavior is being addicted and doing whatever you need to do to get that medication. Look at a patient's history. Are there any psychosocial implications? Are there any interpersonal relationship problems? Are there any arrests? Any other court involvement? Have they been caught doctor shopping? You know what I mean? Come on. Use common sense with each person. We're not cookie cutters. I didn't ask to be born with this congenital anomaly and multiple syndromes and issues. And I certainly didn't ask to be delayed diagnosed for 38 years. And I certainly didn't ask to finally feel like I had someone who was going to help me remove 30 to 40% more skull than he had to. I have a hole in the back of my head that now I have to go back in and get repaired. So I didn't ask for any of this. Tylenol, really? If you don't experience the kind of pain that we are in, shut your mouth about Tylenol and Bufferin and all this other crazy shit. Allow people to find what modalities work for them. Whether it's opioid therapies, ketamine infusion therapies, medical marijuana, shrooms are being used to treat cluster headaches very successfully. In small doses, people are not going to get the psychoactive properties to where they're tripping. I've done shrooms in my lifetime. I've never seen E.T. or Yoda coming after me. It's not a practice that, I partake in all the time. When I was coming off opiates in 2017, I did take some mushrooms one time when I had a really bad cluster headache, and it was effective. We need to start looking at how we can help people and stop hurting them. You know, and if you're someone who has not experienced the level of pain that I and others are experiencing, you have no business judging us or making laws that hurt us. First, do no harm. While telling your patients, telling doctors that we're all crazy and that we're the cause of the overdose epidemic. Let's call it what it is. It's an overdose of illicit drug epidemic. It is not a prescription drug epidemic. Are there people on prescription drugs that started off with acute pain that their doctors kept prescribing? Yes, of course there are. They are not us. Are there people out there who are looking to just get so high they nod off and can't function and don't want to deal with the reality of life? Of course. Those are the people who are turning to illicit fentanyl. It's apples and oranges and tangerines and avocados. You can't put us in the same group. You can't blame us. You can't deny us our human right to not live in excruciating pain. So, as for me, I am too afraid to go to the ER. I don't want to be labeled, treated like crap, harassed. The emotional implication that being treated that way when you have this much pain is actually probably worse than the physical pain. So anyway, that's my video, and yes, I took my medication, and I am not dead because I haven't killed myself, and that's basically it. There's nothing, more to say about it other than there's a bunch of BS going on out there, and we have the right to live. We have the right to get out of bed. We have the right to go to work, to play with our kids, to not be curled up in a ball asking people to cut our heads off. No matter if your condition is Chiari malformation or Ehlers-Danlos syndrome, even I have disc stuff in my back that hurts too. Not all the time, but if my back's out and I need a couple of Vicodin to get me through the day, who the hell are you to tell someone they have to live in that kind of pain when they can't even move? People get really bad toothaches and they're being denied medication temporarily. Use common sense when prescribing. Use common sense in correcting these overreaching, barbaric CDC guidelines that are forcing people to the street. It's dangerous. There has to be a way that we could control the medications, give patients the relief that they need, and also keep everybody safe. And, we also need to help people who are addicted too, because they're in pain. Maybe not physical pain, but there is some pain that's driving them, or some predisposition to becoming an addicted person. So, just, I guess my message is stop being assholes. Start realizing that we're human beings and show a little bit of compassion and love. For me personally, I put a call into Stanford today and let them, and also to my pain doctor, who's not a pain management doctor. I'm not in a contract. He's just very compassionate. And, there's no denying my scans or And they just can't say, oh, well, there's nothing wrong with you at this point. They can't do that anymore. So I've put in calls, and I'm hoping to hear back soon. I do have a surgery scheduled for the beginning of March, so that's why we put the brain surgery off until May. But I don't think that's any longer an option because this is hell. And obviously, there's something really going on. My body wouldn't be this angry right now. So, big love to everybody out there, and thanks for watching my videos. I hope that you know that you're not alone, and hang on, because there are a lot of really good groups of people out there putting on, rallies and getting and signing petitions and creating documents to try to help bring some light and some truth onto this fake, false opioid epidemic. I am pain. I am a legitimate pain patient who is not looking to get complete relief. I know that's impossible. I just want to be able to live my life, and I want you to be able to live yours too.